there's a lot of misinformation, conspiracy theories out there about the coronavirus. There are some commentators who are suggesting that the number of dead are being inflated because they're saying that people who are dying with other issues are being listed as COVID-19 deaths. Perhaps you've seen some of this commentary. You may be too busy to see it, but it is out there. What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded? For example, somebody who might die from a number of factors but had coronavirus are being listed as coronavirus deaths, and because of that, the number is being inflated.
That's a fair question.
Yeah.
And you might also speak about the converse.
Yeah, we've been hearing the converse too. That we've been hearing both sides of that. I think we've made it very clear, I think every time I've been up here, about the comorbidities. And so most of the people, and we talked about the Italy data, the majority of the Italians who succumbed to this had 3 or more comorbidities. So this has been known from the beginning. So those individuals will have an underlying condition, but that underlying condition did not cause their acute death when it's related to a COVID infection. In fact, it's the opposite. Having that underlying condition and getting this virus, we know, is particularly damaging to those individuals. We don't know all the pathophysiology. I wish we did right now. We see a lot of vasculitis, where Tony and I came from. Tony actually, Dr. Fauci started in the vasculitides and Wegener's. So, these are things we have studied for a long time. We are trying to understand the pathophysiology, but what we can tell you at this moment, if you have asthma, if you have renal disease, if you have diabetes, if you have hypertension, these are pre-existing conditions that put you at a greater risk to having a worse outcome.
So, Jim, just to add a comment to that, because, having been through other serious issues, particularly the very painful early years of HIV, AIDS, when people talk about conspiracy theories, you will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions. I can assure you, we have so much to do to protect the health and the welfare of the American people that I would just hope we just put those conspiracy stuff and let somebody write a book about it later on, but not now.